Dr. Megan McGovern, and I'm here with a couple of my patients who both had Ulthera. Carol is several months out, and Dave just had it last week.
So I'm 53, and I just had a conversation with somebody who told me I looked 23, which may be a little stretch, but very flattering nonetheless.
I had to have it done because Carol's been out quite a few months with hers, and she's 10 years younger than me. I'm 62.
You want to be my grandpa.
I didn't want to be the grandfather, and I didn't want it to look like she was going to be my trophy wife. So we decided that
I can still be your trophy wife.
She is your trophy
she
wife.
is my trophy wife. So that's exactly right. But the thing that's amazing to me, just as a guy, because I don't know, what do I know? But when I look at Carol now, I don't see any wrinkles on her face, which is amazing. Now, she was always attractive anyways, and I was okay whether she ever wanted to do this type of treatment or not. And guys have to say that, but I really mean it. But when I look at her now across the table and I look at myself in the mirror, I thought it was time that I had to have something done, so I did. I had the same treatment, and Dr. McGovern can tell you a little bit about that. But it's an amazing process. It lasts about an hour and a half, the process itself, and I'm 1 week out, and maybe you can point out what's different.
I would say there are some subtle differences at this point because it does take 90 days to achieve the results. But you already have some difference around the eyes, and your jawline's already starting to tighten up. So that's cool when we see those early changes.
You see the lines that were a little deeper around the eyes are kind of not as deep. I can see the jawline tightening up here. A little bit more definition in here. I can tell a difference. It's not been that long.
I can tell you the big difference that I see, which was what bothered me the most, is that because of gravity, age, whatever, I had kind of a frown. And so for me, I wanted that to be at least neutral when I wasn't smiling. And for the most part, that's the case. A lot of this stuff here, whatever it's called, has already dissipated, and I don't have those deep shadows. And I'm already really happy about that. I want to look my best. Dr. McGovern, I just want to say that I'm amazed by the changes, transformations. I've had many comments. People know that I've had it done. People who don't know I've had it done are asking me, what's going on. One person said, this is so funny, she says, man, you've lost weight. Something. So they know something's different. Right. And all of those are really compliments. So I'm feeling really good about it. It was a really good decision for me. And so what will happen to me, say, I'm about 6-7 weeks out, what will happen next? What kinds of things can I expect?
Well, in many patients at 6 or 7 weeks, we've barely had any change. So the fact that you've already seen some stuff is early and fabulous. And it's really variable that way. Some people we see some instant gratification and some early changes, and some people it takes longer. It typically really starts building in that second 6-week period. I've had several patients who've had more change at 4 or 5 months. Wow. So how much you'll get is really a crystal ball kind of thing. How much will you get from it? But the fact that you've started getting these kind of comments and results earlier in your course is an indication that you're going to get more powerful results at the end, I would say.
In my case, if the only option I had was surgery, I wouldn't have done it. I can just tell you. And I think most guys would probably fit into that. I know there are extremes, but I think most guys would try to avoid surgery at all costs, particularly for something that might be connected to vanity or one's feeling about themselves. But this gave an option to achieve the end results that are similar or maybe even better. And I have to say, the way I heard another gentleman say this earlier, the way I feel about it, now my mind and my heart's a little more open to some of the other possibilities down the road. So it's kind of given me an opportunity to see it from a different perspective, because I know how I feel about myself now.
With facial rejuvenation, a lot of what's happening is different. It's not truly extra skin, it's damaged skin. It's loss of elasticity. And now that we recognize those things, we can keep you looking normal and avoid the downtime and the stigma and the changes that occur with surgery.
Carol had this treatment done a number of months ago, and she looks marvelous. And she's 10 years younger than me. So with that experience, she already looked younger, of course, and now she looks even way younger. And I had to do something to kind of catch up with that. And I have no regrets. I only have the pleasure of knowing that this has been a good thing for me, and it's been fantastic. I thank you for bringing this into my life and having all this great stuff done.
Contact Dr. Megan McGovern at Coastal Empire Plastic Surgery today to learn more.